actually do the new store event. So yeah, it was awesome to have the guys helping my about speaking to visitors and say this one person. So like I got a picture of the ladies with the parties next to him. My husband did a baby announcement tonight. I love that. Honestly, I love that. So a friend of mine actually ended up commenting, just like, are those things? Yes. I worked with countries for a long time. My sister, this is what the dress looks like.
Okay, we're gonna go ahead and get started.
No, that's so long.
How's everybody doing today? I got a couple thumbs up, so that's good. Yeah, there's actually several of you who haven't been not here or virtual, so I'm happy to see you all in the flesh. Happy to be here in the flesh. It's always a good thing for me. All right, so before we get started, a couple quick things. Let me share screen for our Zoom peeps. Alrighty, so presentations start 1 week from today. So we have one group going a week from today. So that means class will only be half as long. Oh darn. I don't think anyone's super upset about that. And then we do have two groups the Tuesday of Thanksgiving week. I know that's rough. I know people like to try to travel. Please come and support your fellow students because it sucks to present to an empty class. So if you're at all able to be here, please do that. And then after break, that Tuesday that we get back is sport day, so we don't have class. But then that Thursday, that's 3 weeks from today, we have two more groups. So questions about that? Any group panicking and need to switch their day with somebody? I think y'all will be all right.
Yeah, can we just panic in general?
Yeah, you can panic in general. I was like,
Can we spend the second half of the class with only one group is going, doing group camp? Yeah, we all just.
I mean, I could do like something to help with group panic if you want.
I can bring Rosa.
I was gonna say, that would be great.
My service dog that got injured and had to be retired.
She's very sweet. Yeah, I always like when Milburn serve when she can serve better. Yeah, if anyone needs any kind of like meditation, relaxation, I have free service for that. This coming Tuesday, our next class period, we have scheduled a work day for the groups. And I just want to be as helpful to you all as possible. So just show of hands, and let me give you the two options before we do hands. And the two options are for me to like be here, sit here in person, and groups can come talk to me, or for me to sit on Zoom and groups can hop in to talk to me as they need to be. Either way, you wouldn't have to come here, but just like if none of the groups are coming here, yeah, I can be at home with Cindy. So, but if people want me here, I will be here. So how many people would want to be in the classroom with me here floating around? How many people are cool with Zoom? We are on Zoom next Tuesday, and I will just have the Zoom on the whole time and be working at my desk. Pop in, and if more groups than one come in at the same time, we can just like do a breakout room for that group, and then I'll come back to the main room and talk to the next group. Awesome. Cool. So Emily and Haley, hopefully you heard that too. Zoom for everybody next Tuesday, and I'll send an email announcement. I'm going to write that on my hand, otherwise I will not remember. Because as I was telling some people who got here early, I have 250 other emails right now, which I've never had before. So
It's not pointless enough.
it's just, I feel bad because I'm usually like one of the few people in my department that's on top of my email, and that is not my life this year. So Haley says, sounds good. Awesome. Okay, cool. So today I'm going to try to work around our groups, what they'll be covering. So like, we're not going to go over ADHD because we'll have a whole wonderful presentation about that. We're not going to go over FAS because we'll have a whole wonderful presentation about that. But we do have some great stuff we can still go over with some nice videos to illustrate it as well. So just to like reorient you to our schedule coming up here. So Tuesday, whatever that is, 5 days from today, Zoom conferences with me. Next Thursday, our CTE group is going. Woo-hoo. Then the following Tuesday will be PTSD and Lewy body dementia. Then we'll have Thanksgiving. Then we'll have Pork Day. Awkward setting. And then we'll have FAS and ADHD. And then because of the weird way the schedule works this year, I really don't like this like starting in the middle of the week like we did because it throws off the end of the semester. But because of that, we'll have one more day the following week. And that's when our honors folks, so Will and Henry, will give their presentations. And then we can go over any review questions for the final. Our final, really hopefully, is actually just scheduled like on a Thursday. So it's almost like normal class time. It's at 11:30 instead of 1:30, but it's a little more into our normal schedule, which is nice. And the final will be identical in format to the midterm, except in person on paper. We'll only cover stuff since the midterm. So it does not include stuff that was on the midterm. Other than like knowing what a neuron is, type of stuff, right? Like that basic stuff. What's that? I know, right? What's the brain? I don't know. Right? Am I using mine properly? Maybe, I don't know. So it's gonna be kind of a like whirlwind downward slide from here on out. So everybody do what you need to do. Take deep breaths. Have group like screaming time, maybe not in the library. You know, whatever you do. When I drove in today, I saw a student just sitting by the pond in front of the theater. And I was like, that's a great idea. No one uses that space. And I bet it's really peaceful.
I'm not familiar with campus and things, but I wanted to ask them, like, where's a good outdoor spot to like just go? Yeah.
Oh, yeah. If you go to the, like that way on campus, there's an arboretum and there's a like, yeah, the arboretum, if you all don't know, is actually really cool. So whenever a professor retires, they get to choose a native tree and it's planted in their honor. So all the trees that are there represent the professors who have retired.
There are also bee boxes, so like, we have.
Oh, yeah.
We have like, apiaries on campus, but they use the whole entire community of the arboretum for pollination. It's like they get tired, you have boxes, and they have little individual foods. They go in and they take a nap and then they go out.
That's awesome. Yeah, in case you didn't know, it's actually not one of the biologists, it's Dr. Margulies from history, who is our resident beekeeper, so.
He also makes and sells banjos.
He is a man of many talents.
Yeah.
I mean,
Oh, are you? Nice, nice. Are you guys gonna be selling honey this year?
not this year, but we are doing super great this year, so we had to like hunt them this year, so we built like new things and stuff.
Nice. Yeah, in the past, the beekeeping class has sold like honey and wax and stuff on campus. It's awesome. Alrighty. Okay, so let's go ahead and pretend I'm teaching today. Get our heads in focus. And talk about, so we've talked about learning disabilities in different ways throughout the semester, right? We've talked about, in particular, dyslexia and all the types of dyslexia, right? But the term learning disability is an umbrella term for a wide variety of disorders. So when they discovered dyslexia, they were actually studying patients with aphasia. And they sort of just stumbled upon people that like don't have full aphasia, but have these sort of learning issues when they're trying to read. And again, remember, aphasia is loss of language ability. And so they thought maybe these students that are really struggling to keep up and learn just have aphasia. And in fact, what they found is that it's, there's like sort of this lower grade related to reading where you might struggle, flip letters, flip words, all the things we talked about when we talked about the different types. Dyslexia and other learning disabilities can either be developmental or acquired. Does anyone know the difference? Or what would it mean if I said learning disability is developmental? Yeah.
So developmental is more like, it's just a natural thing that occurred as the individual was growing. The other one, I forgot what
Acquired, yeah.
Acquired is more like if they got an injury and acquired it, or had some kind of traumatic, whether physically or emotionally, event that caused this.
Exactly. Yeah. Exactly what Will said. So developmental is, maybe it's something genetic, or maybe it's acquired during, the birthing process, or something happens. Again, it's typically genetic or from birth, essentially. Acquired would be you've actually learned to read at least a little, and then, like Will said, you have some sort of damage, and that leads to you developing these issues. Learning disabilities are actually more frequently occurring than people know. So about 10 to 15% of the school-age population has a diagnosable learning disability that we know of. We are also missing kids, and we know that too, right? So I would guess that might be closer to like 20% if we could capture everybody. The way people are traditionally classified as having a learning disability is if they are 2 years behind in school. So you find more disabilities in older children just because they sort of have a longer time point to reference. And in terms of problems with assessment, it can vary from institution to institution how they assess. And even if they're doing some sort of standardized assessment, what they're using. Are they using just like a standardized achievement test? Or, are they handing out a questionnaire? Okay, and like, fill this out. Let's see if you have a learning disability. So there's a whole bunch of different things that can contribute to learning disabilities. The first is phonological deficiencies. And this is phonics. So if anyone remembers, gosh, you all are probably too young. But when I was growing, there was, Debbie and I remember, there was this person like, hooked on phonics, worked for me. And I think a lot of, especially early childhood development institutions teach based on phonetic reading now. So instead of like learning the letters or learning whole words, you teach kids to sound them out, and it makes it a lot easier. So phonological reading is decoding by the sounds of the words. The more traditional way of reading, that memorization of words, is called graphemic reading. And reading really does depend on those phonological skills, especially at the beginning. As we get older, as we get more proficient, even if we're not purposely trying to memorize words, it just happens, right? And so those graphemic skills come in more. So kiddos that have phonological deficiencies, impairments with awareness of sounds, particularly these letter sounds, right? They are going to possibly struggle. And I'm not going to get too much into attentional deficiencies because, again, we have a group that's going to cover this in detail. But even if you don't have enough of an attentional deficiency to like meet criteria for ADHD, for example, even a little bit of that can contribute to something like a dyslexia, right? Because it can mean you don't learn some of those initial things, or just like focusing, paying attention on what you're supposed to be reading can be difficult. We also know that there are sensory deficiencies, and we're going to talk in a couple, I was going to say a couple slides, but I'm not doing slides, so a couple pages of notes about autism spectrum disorders briefly. And those are an issue there, but we know that individuals with reading disabilities need a longer interval between even tones. So like if we play people just musical notes, basically. People who have learning disabilities need a longer gap between notes in order to be distinguishing between them. So that says it's not just word specific, right? There's something overall going on in a sensory way. There are some ideas about some motor deficiencies in the cerebellum that does control acts of movement, timing, and coordination. So certainly those could be related to both reading and writing, right? And all of these are different theories. And just like with anything else we look at for theories in psych, it's probably the most true that a combination of these theories is correct, right? It's rare that we have one theory that actually explains everything. And we also know that subpopulations of, in particular, disabled readers or disordered readers display different deficits. So the major cause seems to lie in that language processing, but these other areas can contribute. So as we talked about at the beginning of the semester, some of the standard neuropsychological tests would be involved in this. So when we gave, let's say, learning disability, dyslexia test, we would give everybody a WAIS, so the full intelligence test. And then we would also give what's called the WIAT, which is the Wechsler Individual Achievement Test. Hey, I remember this. So it's written by the same people as the WAIS. And it's an achievement test where you have them do things like read passages and write sentences and spell and do basic math problems. And then because it's created by the same people as the WAIS, there are actually ways that you can calculate how the scores on that achievement test differ from their ability as measured by the WAIS. So doing that is a really nice way to say, here's where the deficiencies are. These are the places that we can target with, say, an individualized education plan. Verbal fluency doesn't like improve with age. It's almost static in people with dyslexia. And then they also sometimes struggle with like left-right differentiation tasks, although perform at chance. So it's almost like they're guessing every time. So again, it does seem like it's more than just language-based ability, that there's something bigger going on. All right. The next thing we're going to talk about in passing here, short, is cerebral palsy. So the primary characteristic of cerebral, actually, hang on. I have some videos about dyslexia that will, I think, be more helpful. So the first one I'm going to show is what it's like to have dyslexia, which I think is really helpful to try to like put yourself in the shoes of someone who has it. And just a sec. The speakers are working. It's just a matter of whether I can get them to actually take the sound. Looks like no. Okay. So I will just do what I did the other day and crank all the volumes here. Okay. you can see, and again, these experiences are going to be different for different people with dyslexia, but all the different experiences they might have, right? Words appearing to move, words appearing like covered with like lots of color. You know, it could just be really hard to focus or concentrate. So it can be really a challenge. I also really like this one. This is what not to say to someone with a learning disability.
You just need to focus.
Oh, I'm a bit dyslexic too.
You're slow, aren't you?
Can you spell dyslexia?
D-Y-S Lexia.
You must hate reading.
Obviously I do.
See, I'm the complete opposite. I love reading.
It takes me ages and ages to read books.
I'm 21, I've read one book in my life.
So I didn't read till I was 12 and then I read a book a day.
It's a glitch, because when I read, I sometimes read and I follow the sentence down and then I go back up.
I would end up reading the exact same line over and over.
The words when I used to read used to move around and just get crazy.
I get extra letters and letters going.
Mixed rounds,
Yeah, they just, you know, they're just funky, and sometimes like, hey, I'm gonna go over here, and it's like, you're not meant to go there.
Have you tried spell check?
Yes.
I was literally about to say spell check is my best friend.
Spell check is useless because if you can't spell the word in the first place, you don't know whether it's correcting it to be right or wrong.
After you do like an essay or something like that, you can just press one button and you'd be like, yeah, that's what I meant. That's what I meant. That's what I meant.
Social media is the worst. I have to get 3 people to check anything I post just in case I put something really rude.
I hate it at the same time. Did you mean this? You condescending little prick. But yes, please, thank you, thank you.
You just need to focus.
So I've had that all my life. You need to focus, you need to focus. You're not focusing, you need to try harder.
My parents, my teachers thought I had attitude problems.
I'm lazy.
To people.
According to my mum, I'm lazy.
Lazy gang.
And they just thought I was rude, as opposed to thinking that I couldn't engage with what was happening.
I'll put post-it notes around your room, like do a mind map, use different colours. That never used to work for me.
Because everyone is different. Everyone should, in my opinion, learn in a different way or at a different speed.
I enjoy going at my own pace. You know, I'm not lazy. I just like going things at my own pace. You know?
To all of those people, yeah.
Oh, it's not fair that you get longer on exams.
I would swap it in a heartbeat though, to not have dyslexia.
I've had people say, well, you shouldn't get extra time in exams because you don't have extra time in life.
You could give me the whole night and I'm still not going to finish it.
I basically wouldn't have any qualifications if I didn't have extra time.
If you've got a additional educational need and you read a bit slower, you need to be given that time to process.
Everything that was going on in my head, I wanted to put it on the piece of paper, but I couldn't read fast enough and I just couldn't write fast enough. And it just used to make me panic and I used to have the worst anxiety attacks.
Oh, I'm a bit dyslexic too.
A bit, a smidge.
Oh, I'm dyslexic too. I think it's kind of like condescending sometimes, because I think sometimes people are actually faking it.
They don't get what dyslexia means, so it's kind of their own ignorance.
It's just the ambiguity of it. It's like, if you're bad at reading or you don't like reading or like say you got ADHD or I think there's loads of things that you could mistake for it.
The people who are actually genuinely dyslexic, it's incredibly frustrating and
Really patronising.
Yeah, really patronising.
I've had people say this to me and I kind of feel like they're trying to belittle.
Who I am.
Yeah.
Any true dyslexic wouldn't go, I'm a dyslexic as well. You try and hide it the best you can.
Yeah.
As soon as someone finds you out, you just go, yeah, I am. And you instantly become very aggressive towards them.
And
What? Come on then.
Okay, you're just a bit thick.
Cold world.
Stupid, bit of an idiot.
Slow, I've been called an idiot, I've been called weird.
Waste of space.
Well, maybe dyslexic people are stupid, but by someone else's standard.
Yes, it's important to talk about diversity as race and gender and all these different things, but there's also diversity in how people learn.
If you're trying to take a super fast test and you're dyslexic, then yeah, you're fucking stupid.
You'll never amount to anything.
So I've just graduated in nutritional science.
I'm doing a master's in molecular biophysics.
I'm an officer in the Merchant Navy.
And they were all like, yeah, she's not gonna do anything, she's got loads of negativity, she's not trying.
It was almost something that I said to myself in sixth form as well, and I think that's the worst thing. I started believing it.
It's about perseverance.
Yeah, no, definitely.
Key motto in life.
Don't worry, you'll grow out of it.
You will learn to cope. Is probably like.
I didn't grow out of it. I would say
yeah.
I grew into it.
You know, it's taken me so long and all my life of being crap, 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 crap. And then now I'm like, actually, I have a reason and I know why it is. And this is my reason. I'm not being stupid.
I probably wouldn't have learned that I was really creative and that I could do something with that.
I wouldn't be me, and I wouldn't have like some of the amazing ideas that I have without thinking in the way that I think.
Do the stand up and say, I'm Declan and I'm dyslexic.
I'm Priya and I'm dyslexic.
Yeah, that's it. It's just.
Alrighty. So Emily shared having ADHD. I've had professors comment on how slow I'm taking on tests. Oh, those are called microaggressions. I've had so many people tell me they're jealous of the extra time or disagree that I have to get extended time on my tests. How lucky I am that I do. And if you have one of these disabilities, you need that extra time. It's just leveling the playing field, right? And sometimes it's even really not enough, let's be honest, right? So I think that that's a really important point. And thank you, Emily, for sharing your experience of how frustrating and annoying. Has anyone ever heard people making comments like that to other folks? So she's not, yeah.
So my husband has ADHD and dyslexia, and my parents, when they first met him, they would see him like staring off into space or, he'd change the subject in a way that didn't really make sense. And we jokingly call it dolphin brain. And then when I told them about, he has ADHD and dyslexia, so whenever he'd do something or say something that seemed out of the ordinary, then they can pinpoint and be like, oh, okay, that makes sense. I like the term dolphin brain for it because I saw that actually on social media. It's like you see what's going on the surface, you see the random change in conversation, but you don't see what's going on under the water, all those connections that were made to lead you there. So we just started calling it that.
I like it. Yeah, I mean, this certainly can interfere with everyday functioning as well, right? I'm just gonna do this first. I know it's totally annoying for you right now. I'm gonna pull your thing back in here. Oh, you did that too. Yep, I'm just like, I see a problem with this. Yeah, so people don't understand, right? And this is something as common as a learning disability. Now imagine someone with any of the more severe disorders we've talked about this semester and how much they might struggle, right? It'd be really hard. All right, so now I'm going to move on and talk about cerebral palsy, which the primary characteristic is motor abnormalities. There can be some cognitive impairments as well. This is not as common. It's only like 6 per 1,000 births. 65% of people with cerebral palsy will need occupational services or occasional services, sorry. 10% won't need any special services, and about a quarter will need special schooling, so special ed. They have different types of motor symptoms they can have. It tends to be associated with difficult labor and premature birth, and in particular asphyxia during the birth process. So if the baby gets stuck in the birth canal, for example, right, and doesn't have access to oxygen, those things can be problematic. So maybe not surprisingly, since the primary thing is motor abnormalities, the basal ganglia are implicated here. Also corticospinal tracts, the brainstem, and the cerebellum. And again, just thumbnail sketch of cerebral palsy. One that I'll talk a little more about is hydrocephalus, just because when I took a version of this class as a grad student, more advanced, obviously, one of the things we did was write white papers about various disorders. And one of the ones that I wrote was about hydrocephalus. So I have a lot of decent knowledge about it here. So hydrocephalus is increased volume of cerebral spinal fluid. which is that fluid that's in our ventricles, our spinal column, around our brain, right? It just like protects everything. But if you have too much, right, it's called water on the brain. It essentially can make your head swell, can put pressure on the brain. It can be fatal. So it results from shrinking of the brain tissue around the ventricles. And then there's obstruction of flow of the cerebrospinal fluid in the expansion of the ventricles. And there's some suggestion that in some folks it may be overproduction of cerebrospinal fluid. Their body just makes more. It's relatively common to find in stillbirths. So if you're not familiar with what a stillbirth is, it's a pregnancy where the baby is born non-viable. The baby is essentially born dead. And it's far enough along that the mother has to deliver the fetus, which is really hard, if you can imagine, to go through the process of labor, knowing that you're delivering someone that's not alive. We also see it most commonly in newborns and early infancy. The incidence, there we go, for uncomplicated congenital hydrocephalus is about 1 in 1,000. The hydrocephalus can be a complication of spinal bifida, and that's also about 1 in 1,000. And it can be just genetic, or similar to cerebral palsy, it can be acquired around the time of labor and birth due to some sort of problem in the birthing process or an injury. In terms of the symptoms, infants tend to be irritable. They won't eat. Whatever they do eat, they vomit back up. They won't gain weight. And this won't be as obvious because due to the hydrocephalus, they will gain weight due to the fluids in their skull, right? But they're not gaining weight all over. So if the head circumference of the infant is 2 standard deviations above the mean for that age, then that's when it deserves investigation. But obviously, if it starts to get near there, we're going to keep an eye on it. One of the major signs, so things that other people can determine or detect, is the setting sun sign. And this will be the retraction of the upper eyelid without an up gaze. So, you know, like if our eyelids go up, our eyes usually go up, right? I don't even know if I can do it without holding my eyelid. Essentially, like your eyelid goes up, but you keep looking forward or down. So it seems like the iris of the eye seems to set beneath your lower lid. There are sluggish reactions to light and or no visual response at all. In kids, if this develops a little bit later, they again are going to have the large head. They will be able to report headaches, right? They will also experience vomiting. They often also don't want to eat. They'll have trouble making progress in school. Sometimes they won't be able to attend school. We'll see changes in behavior. Sometimes it's associated with epilepsy-like seizures. And let's see, migraines. And for some bizarre reason in kids with hydrocephalus, there's an increased incidence of left-handedness. No idea why. Maybe they have to try to essentially figure stuff out and compensate for things. We see a general delay and or failure to make appropriate visual or social contact. Also motor problems. And when it's in kids or adults, there can be a history of essentially normal development, right? Followed by increased concern. In adults, we see recurring and increasingly unremitting headache. But also in adults, it can like look like a cold. You can have like coughing and sneezing, nausea, vomiting, that gaze issue. And it can also lead to symptoms that look like dementia. So overall, there are general delays and motor deficits. Interestingly, kiddos will tend to be in the normal range for full-scale IQ if you give them like a WIS. But their verbal tests will be better than their performance tests. One of the main treatments for it is an insertion of a valve to drain the fluid. This is called a shunt. And when kids are shunted, they can actually be in mainstream classrooms. If those kids who are shunted do end up in some sort of special school or special ed classroom, it's often due to behavioral problems rather than lack of intellect. They'll sometimes have problems with their gait, so with walking in what we would consider a normal way, especially when it's coupled with spinal bifida. And they'll have impaired fine motor functioning and some attentional and perceptual deficits. Adults will just see deterioration of their intellect and behavior. One of the really interesting things is that they'll have a loss of insight into this deterioration. They won't realize they're losing these functions. And they'll have short-term memory issues and cognitive and psychomotor slowing. If it happens prenatally, you can actually diagnose it just using a normal ultrasound. And then parents can choose whether or not to terminate the pregnancy based on the knowledge they have. They will typically do repeat scans just because, again, particularly if the fetus moves around a lot, these can't always be that accurate. To give you guys an example, when I went for my 20-week scan, which is when they typically, we didn't want to find out the sex, but typically sex the baby and just check out all the major systems. We kind of warned the tech. We were like, this fetus moves a lot. And she's seen a billion fetuses, so she's like, yeah, okay, whatever. And then as she starts it, she goes, whoa. And apparently she went from normal position to breech, like, I wonder how she got a knot in her umbilical cord. And then she just came down here and hid in this part of my uterus for the rest of it. And so they were having a hard time getting her heartbeat or a picture of her heart because she was just laying on her back holding her feet. Right? And so you want to make sure you work with those types of things, right? To really clarify that it's not something silly like your child being a pretzel, which is what the ultrasound typed on the picture. Pretzel. In adults, things like a CT scan or an MRI can be used to diagnose. Now, as I mentioned, it's treated with shunting to drain that excess cerebral spinal fluid. With shunting, as you can imagine, it can lead to other complications. You've got a drain in your brain, right? So you can have infection as a result. Blockage of the shunt is going to be problematic if that happens. Disconnection of the shunt. Migration of tubing, and any of those can actually lead to epileptic-like seizures. Other things they do sometimes, compressive head wrapping. There are medications you can give, and sometimes they will do a lumbar puncture, which is where they take a giant needle, put it in your low spine, and just suck out as much cerebral spinal fluid as they can to try to offset it. As I mentioned previously, those who are shunted can often develop normal intellect. If hydrocephalus remains undiagnosed in adults, it can lead to severe dementia. That would look like Alzheimer's or vascular dementia. In terms of differential diagnosis, again, in adults, you're going to want to look at the dementias. In infants and children, you want to you want to look at metabolic disorders or raised intracranial pressure for other reasons, like a bleed on the brain, right? And neuroimaging can fix your differential diagnosis like that for all of them. So obviously something that's really scary if it happens, if untreated, very severe, but we do have treatments that work now. And as I mentioned, if it's properly treated, it can develop fairly normally. I don't think I have any videos about hydrocephalus, but Let me check to make sure I'm not lying. I think the other ones I have are about, yeah, autism spectrum disorder. Okay. Which is what we're going to talk about next. So first things first, I'll talk about here is that when the DSM-5 came out in 2013, a lot of disorders that used to be separate diagnoses were lumped together under autism spectrum disorder. So for example, you may have heard of Asperger's. That's not a separate diagnosis anymore. And now you would just be diagnosed with high functioning autism spectrum disorder. This caused problems for a couple reasons, as you can imagine. One was that a lot of people who had Asperger's really identified with that label, right? That makes sense to them. Probably the bigger reason, and we know this fairly intimately because my husband's best friend, this is what he does. He actually is now, at that point he was like more of a clinician, now he's in management for a company that works with kids with autism spectrum disorders. And every kid they had who had been diagnosed with Asperger's, they had to go through and re-diagnose, otherwise insurance wouldn't pay for care anymore. So just think about the amount of time and resources that would be wasted to do that, right? And putting a kid who already doesn't necessarily like to focus, right, through a whole set of testing again. That being said, it is what it is now, right? So everyone's on that spectrum. Yeah.
A whole bunch of people diagnosed with Asperger's that still consider themselves to a lot of themselves Asperger's don't super vibe with the whole high functioning versus low functioning debate. It's considered really ableist to a lot of people, and that the way that you function is thereby determinant of how useful you are to society. And so a lot of people that you know, are kind of in the heart of the debate between like high functioning, low functioning, what other terms we use, are instead, you know, asking questions, what needs do you have, rather than defining them by their ability function.
And that's beautiful, and I love that. Yeah, yeah. Hopefully, you all heard what Miranda said, but yeah, the idea that high functioning and low functioning is not a label that people with these disorders typically like, because it is very ableist. Honestly, a lot of the language and even the activism around autism spectrum disorder is very ableist.
Don't support autism speaks.
Yeah, most people who are on the spectrum will say you do not support autism speaks. They see it as almost like eugenics, essentially, that they want to eradicate neurodiversity rather than celebrating it. So if you're not familiar with the term neurodiversity, this is a term that a lot of people who have not only autism spectrum disorders, but other similar disorders that cause them to think about things in distinct ways, right? They really like vibe with, enjoy, adopt that term, and then those of us who don't have that would be considered neurotypical. So neurodiversity is something that they argue should be celebrated rather than trying to eradicate it, and some organizations like Autism Speaks don't vibe with that.
I know there's also been a lot of debate around calling people autistic or calling them a person with autism.
That in general is a problem. So if you look at old documentation, even in psychology written by psychologists, they'll be like anorexics, depressives, autistics, and that's really problematic, right? So what we try to do is what's called person first language now. So like a person with autism, a patient with anorexia nervosa, things along those lines. Yeah, because a person isn't a disease, right? A person is a whole host of things. Okay, that's what I figured. And so, yeah, watch that use of terminology. It's something you still find. So I chose a new book for my intro to women's and gender studies class this year, which you think would be aware of these language issues, and they referred to people with eating disorders as anorexics and bulimics. And so, like, when the semester ends and I've like gotten over my absolute anger, I'm going to write the authors a nice note and explain why that's problematic.
I'm autistic, and I mean, like, person first language is definitely a good thing to consider, and I think that it's better to be safe than sorry, and that using person first language is generally like non-intuitive. but I'm personally like, I'm like, yeah, I'm autistic.
And I think it's okay to say I'm autistic or that person is autistic, but it's when you're an autistic, right? It's different. Yeah, yeah. And so
But
that's
also like in LGBT language, like
Mhm.
we've kind of taken the word queer, but
Yeah.
it's not, if like an old American would feel like you're queer, I'd be like, this is problematic. Guy.
right. Yeah, and I think that that's really important. So whether you're working with people with neurodiverse, people with other forms of diversity, the most important thing to do is to ask them which language they prefer, right? So for example, if you're working with indigenous peoples, do you prefer to be called Native American, American Indian, First Nations peoples, or just your tribal, your ancestry, right? Navajo, Hopi, what have you, rather than trying to impose that on them from the outside is really important as well. So this is something that the harder psychological sciences like neuropsychology don't always get into, that you'll see more in the softer, I hate those terms, but that's what's used, side of things, the more social psyche side of things. And I think it's an important bridge we need to make, is that we need to be thinking about these things, whether we're studying, rat brains or, diverse people of color on our college campuses, right? We need to be thinking about the whole person, the whole animal, the whole concept we're thinking of, and be mindful about our language and be mindful about how we're describing things. I'm obviously super biased because I also teach women's and gender studies classes, and that's just like the core of that discipline, right? As is the core of a lot of clinical psychology as well. So, but I think that is one place where our more biopsyche people can benefit from the social psyche side. Yes, so excellent points. So there are a whole host of symptoms that we can see in people with autism spectrum disorders. And what we tend to see are impaired social interaction, again, by neurotypical standards. Remember that we're always defining everything by neurotypical standards. Sometimes really narrow interests, which could be a symptom, but could be something that is an advantage, right? So maybe someone with a spectrum disorder on the spectrum, so another way they're described, really is into studying space, right? But they channel that into becoming an aeronautics engineer, right? Cool, awesome. You found a way to really make that work. And honestly, that's not any different than those of us who have a really compassionate soul choosing to go into counseling, right? But because it's seen as weird or different, it's stigmatized, which is bizarre, in my opinion. But again, I just told you my background. So, and also language and communication abnormalities. And again, these can vary drastically. There are people on the spectrum who you wouldn't be able to tell are on the spectrum. There are people on the spectrum who are completely nonverbal. So when I taught abnormal psych when I was in grad school, our library had a great documentary that I would show called Autism is a Word. And it was a nonverbal woman who would use the old saying spells. So this is before cell phone apps, that good stuff. And she'd type out what she wanted to say and communicate that way with the people around her. Depending again on their particular presentation, they may have preserved intellect. It does seem to be more prevalent in boys, but I wonder how much of that, like ADHD, to steal a little bit of the ADHD group's thunder, is misdiagnosis or misdiagnosis. Because of the way they're socialized, girls tend to be quieter, not as disruptive. And so we sometimes miss learning disabilities, ADHD, spectrum disorders in girls. Yeah.
So I have a friend who, she's got 3 brothers and all 3 of them are autistic. So their mom, who is family to me, is regularly sharing information for autism awareness. And I think that's really cool, but some of the stuff she's been sharing recently is about how nowadays people are trying to reinforce the idea that self-diagnosis with stuff like that is okay because of the phenomenon of women and girls getting underdiagnosed.
Exactly. And clearly, if you have self-diagnosed, then you go to a medical professional, get it on your record, so you get all the benefits. But yeah, this is really the case. And this is the case in a lot of psychological disorders in general, right? So for example, depression. We tend to miss depression in men and boys. And this is one of the reasons why boys are more likely to die by suicide than girls. They also choose more lethal methods, so that's a piece of it. But we're missing their depression because we're just telling them to man up and things like that, right? And so those things are problematic, and we need to remove these stigmas and just look at people objectively. But we also have to recognize that clinicians are people and bring their own biases into the room. And as much as we try to train that out of people, right? It's there, we're surrounded by it. It's the water we swim in every day. So yeah, really good point that we need to listen to patients as well. And when they come in saying, I think I have this, and at least test for it, maybe. Or
It could be forever to get someone to test it.
I'm sure. Yeah.
Well, you're in college, you get this thing grades, you're fine, and then like you don't understand how much of a fight it is for you to do that.
Right, exactly. Yeah. So, sometimes you just have to be an advocate for yourself, which is really, really hard if you are struggling with one of these things, right? And having friends, family advocate for you as well can be really important. And here, having the counselors or CRIT in the LRC be advocates for you as well can be really helpful. But I also know people have mixed experiences with everyone they know, so I want to acknowledge that as well. Yeah.
So I have a question. I'm wondering if you have any experience with this, but I know a lot of people for a while were thinking that kids were being overdiagnosed with ADHD. They're not actually hyperactive, they're just kids, they have a lot of energy. But at the same time, I know there are a lot of people who get their kids tested and diagnosed for autism at a very young age too. Do you think that they're kind of on the same level?
That's a good question. I'm
Kids
not,
are quirky.
I'm not as expert in autism spectrum disorders as I am in, say, ADHD. So I don't want to make broad generalized statements. But I think any time we have a diagnosis that almost becomes a trend, right? So this happened when I was in grad school. All of a sudden it wasn't ADHD, all the kids had bipolar disorder. And so I remember The Onion at the time came out with like infants now being diagnosed with bipolar disorder, right? Like they just cry, well, but so we have to be cautious about that. I also though think that part of what's happening with autism spectrum disorder is we just have a greater recognition of it. And so we're finding more patients than we did in the past because of that. But yeah, it'll be interesting to see 5-10 years down the road as our science evolves, if we might even find that some of those people might have something different, right? Or we know that, for example, a lot of people have been diagnosed like just ADHD in the past who also have autism spectrum disorder, and they actually co-occur fairly frequently. So making sure we're catching all those pieces is really important. That's a really good question that I think it'll be really interesting to, again, see how things evolve as we go forward.
Because I was talking about, I am in the child technology class, and we were all kind of having a bit of a disagreement about ADHD as a disorder on ownership. And it was kind of interesting because I'm of the full and complete mindset that ADHD is a disorder and people need to be treated for it, and that we can quantify it, we can see it. But a lot of my classmates were kind of more of the mindset that it's not real.
Oh, interesting. I've never heard that, I don't think, before.
Or that it's just like kids have energy, we're just over medicating our children.
I mean, certainly in the 80s and 90s, there was a tendency to do that, to be honest. At the same time, ADHD does exist. At the same time, again, from my own personal experience, we also need to look and make sure our ADHD diagnoses are actually ADHD patients. So a lot of people I saw, not only for learning disabilities, but things like ADHD, had been diagnosed with like a one-page questionnaire when they were kids. And in fact, what they had was anxiety, right? Like, for example, one person I remember had severe test anxiety. So they'd go into a test and like they'd blank out and they couldn't remember anything. They do horribly. or they'd have trouble studying because they're so anxious, right? And yet they've been diagnosed with ADHD because you're just having attentional problems. That's why that happens. Exactly, exactly. The symptoms can be similar. You can still get accommodations for test anxiety. But the other great thing is we have really good treatments for that, right? And it would just sort of like break your heart that like this person could have had this at least bettered, if not fixed for them years previously, right? But they've been misdiagnosed. So.
And also it's interesting too is the differences in the way certain disorders are presented by different genders.
Oh yeah.
And how, especially after I've been looking at the ADHD, a lot of how different it is women and why a lot of women are not diagnosed with it because it doesn't present the same way that the typical.
Particularly girls, and again, I'm trying not to steal too much of that group's thunder, but girls who have ADHD tend to have more of the like inattentional part of it rather than the hyperactive part. And again, I think a lot more of that is because they're socialized to think I can't act on this. Boys run around, girls don't do that, girls sit down, right? And so they'll just be staring out the window, not getting any of the lesson. Whereas the boy who's disruptive is much more likely to get referred for services. Yeah, I think that's a big piece of it.
And that's how I feel in the rehab office for so long, is that I had to get diagnosed on my own as an adult, and my family still was not a great diagnosis. But they're like, how you're fine to fine. I'm like, bro, it's not
Yeah,
fine.
yeah. I think I told you, and I might have even shared this report at the beginning of the semester. The patient I saw with dyscalculia, that like he had been homeschooled and just like allowed to go at his own pace. Never diagnosed. And so he was 33, I think, when I saw him, and hadn't even passed his GED. So he was like living at home, didn't have a high school diploma. And you know, as soon as we figured out he had dyscalculia and we got him treatment for depression, I was related to the fact that he was still having to live at home when he didn't want to, right? He was able to get extra time on his GED and he was able to pass it. Right. So again, just so frustrating that again, his family had the best of intentions. They really thought they were doing the right thing for him. But because he was outside the system, because no one ever caught this, he had been without the services that would have helped him for years, literal years, like half his life. Because I think it first sort of emerged when he was 15. Right. Yeah. So access to care is really important. And it's a huge barrier, right? Because if you're not part of the public school system, or you are part of the public school system and your district is underfunded, I think I've told you all about the school psychologist I know who covers an entire county in the western part of the state, right? Some school psychologists will just have a school and still have a wait list. But she is responsible for all the elementary, middle, and high schools for the entire county. Right. So if you don't have access to those services, that can delay care. It can mean you're not diagnosed, and it can be really, really difficult. So this is really interesting. So I made these notes. I want to say the first time I taught this class was like 2011. And in my notes, I have develops between 1 and 3, but we now know that's not true. There are actually differences as early as a month old in gaze of children that end up being diagnosed with autism spectrum versus not. That even as young as a month old, those without autism spectrum disorder will hold a gaze longer on a face. So again, this whole idea that like they're somehow caused by vaccines, right? No. You haven't had any vaccines at that point, right? Plus, all those studies were just proving all that stuff. There were different theories about whether there could be genetic influences, probably, whether it might be caused by viruses, maybe a little tiny bit. They do have brain abnormalities, so they do have larger head and brain size, brainstem abnormalities, and certain neurons may not develop fully. You can also be diagnosed with pervasive developmental disorders, and these are essentially kind of things that look like an autism spectrum disorder but aren't. We have a lot of categories in the DSM that acknowledge we don't have categories for everything. So for example, you might have unspecified blah, 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 developmental disorder, for example. Or you might have other specified, blah, 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 blah. So for example, in the eating disorder world, we have other specified feeding and eating disorders, OSFED. And these are basically things that should be diagnoses, but because they're so rare, the DSM doesn't bother making them diagnoses, but certainly there are people who get diagnosed with them. So an example in eating disorders is purging disorder, which is where someone purges everything they eat without binging. And it's obviously just as dangerous, if not more so, than anorexia or bulimia. But because it's rare, it's just like thrown in this other category. So that's that, and that's what happens with this as well. Yeah.
What's really frustrating about having an unspecified disorder is that it doesn't really count as a disability.
Yep.
So therefore, and a lot of times, like doctors will say, okay, well, you have an unspecified whatever, and that's that. But they don't continue testing. You have to fight to get anything done, and it's about having unspecified autoimmune disorder. So I can't. I don't know what's wrong with me. And that was like one of the other things frustrating me. It's like, what's actually wrong with you? You don't know. There's something wrong with you. You don't know.
Right.
Unspecified disorder is not water.
Exactly. Yeah. And I mean, the reason we diagnose them is so that like people can get, like you can treat, you know, those unspecified diagnoses or other specified diagnoses. But yeah, some people just stop there. Like, here's a kind of diagnosis, right? And it can be arranged. So I've been given like a unspecified upper respiratory infection before, right? It's like, well, you don't quite have bronchitis, but almost, right? And like that's different than like your whole life being controlled by something. Yeah, that's fine. Yeah, yeah. So for those of you on Zoom who might not have heard what Sasha asked us is, do you think a Charcot humans like to categorize things? Yes. I think our executive functioning goes haywire, right? When we can't have that and we really struggle with it. And again, not only as an individual wanting some sort of identification, right? But also like exactly what Debbie's just saying. Sometimes it means it bars you from access to further testing or care, and that could be really problematic. Yeah, I think that's a huge part of things. Another disorder that's on the spectrum is Fragile X. And this is, maybe not surprisingly, linked to the X chromosome. And it's more common and more severe in men because you remember back to basic genetics, men have, yeah, an X and a Y, right? So they only need one X with the Fragile X gene on it to get this disorder, whereas women would need two because it's recessive. So there are facial abnormalities here, huge developmental delays, can also have attention deficits and hyperactivity and anxiety and unstable mood. So all those like trendy diagnoses we just talked about, ADHD, bipolar, all that good stuff, rolled into one. Basically the dendrites, those things that reach out of the cell bodies of neurons, are poorly formed. The cortex is very thin. The ventricle is, there's an increase in ventricular size. So that is that. I have a couple of videos here I will show, so let me go ahead and screen share about the spectrum disorders. So the first one is just like an informational one.
I will push you. I will test you. I'll demand everything you've got. What do you get? Everything I have.
CIA pays YouTube a lot of money, so you can't skip their ads.
A lot of people talk about autism, but not everyone understands what it is. Autism spectrum disorder, or ASD, affects how people communicate with and relate to others. This isn't the same as being shy or not knowing what to say. Most people with autism don't understand some of the basic social conventions that others take for granted. They might have trouble making eye contact, holding a conversation, or recognizing gestures. And over 1/3 of people with ASD are nonverbal, meaning they don't use speech. Along with communication issues, people with autism often like to follow certain patterns or repeated behaviors. Many have a sensitivity to bright light or loud noises, and others have physical problems like trouble walking or picking up small objects. Some have intellectual disabilities, but about half have average or above average IQs. It's also common for people with autism to have a great long-term memory for certain details, and many excel in math, science, music, or art. With such a wide variety of symptoms, no two people with ASD are alike. The behaviors vary so much that they used to be classified as different disorders. One was Asperger's syndrome, where people obsess over particular topics, miss nonverbal social cues, and may not understand appropriate social behavior. In 2013, scientists realized that the boundary between Asperger's syndrome and some of the other disorders was fuzzy, so they decided to put them all under one name. This made it easier to diagnose autism, which is important. The younger someone is diagnosed, the earlier they can get help. In fact, many children who have autism will show signs by just 2 years old, including not responding to their name, avoiding eye contact, and flapping their hands or rocking repeatedly. Even though there is no cure for ASD, therapy and medication can help people adjust. Scientists are also doing clinical trials to find other solutions. They've learned that 1 out of every 68 children in the US has the disorder, but they still aren't sure what causes it. Autism is over 4 times more common in boys than girls, and most scientists think genes play a role because it often runs in families. Some people with ASD have abnormal chromosomes, but this can't be the whole story. There are people with the same gene changes who don't have autism. Other possible causes include having older parents, being exposed to high levels of testosterone in the womb, and having complications during pregnancy or birth. It may even have something to do with gut bacteria, since many autistic people have gastrointestinal issues. But most likely, it's a combination of many factors. The one thing scientists know for sure is that vaccines do not cause autism. No matter why it happens, ASD is being diagnosed at a higher rate every year. This doesn't mean it's becoming more common. It just means more people are aware of the condition and getting diagnosed early. And awareness is crucial. The more we learn about autism, the more we can understand and relate to those who have it. It's important to note that people with ASD deserve the same respect, fairness, and chances that people without ASD receive. This will help people with ASD adapt and grow in our communities. We've put some resources in the description if you would like to learn more about ASD and figure out.
If anyone is interested in those resources, this video is linked on Blackboard. The next one I'm going to show is the LOVAS method, which is the basis for applied behavioral analysis, or ABA. Now, full disclosure, here, this is also controversial. Some people who are on the spectrum, are neurodiverse, believe that this is really problematic because it's trying to change their behaviors. Other people have said it's kind of like life-changing. So, I don't know. I feel like for treatments, we shouldn't take away things if they work for some people. We also shouldn't enforce them on people who don't want them. That's my 2 cents. But I'm going to show just a piece of this. This is the original guy, LOVAS, doing this. And this is going to be weird, to be honest, for those of you who aren't familiar with it. It's a lot like training a pet. They use reinforcement. And so they're reinforcing basic behaviors. So some people, that makes them very uncomfortable. So I like to give that disclaimer.
In teaching verbal imitation, start with a sound which is easy to make and can be seen.
Oh, good girl. Look. Ah. Aw.
The teacher may wait for response or reinforce approximations like the open mouth.
Aw.
Good girl. That's nice. Say aw. Aw.
Aw.
Good girl. Look. Aw. Aw.
Aw.
Good girl. That's nice.
Select a second sound that sounds.
Mama.
Good.
So I'm gonna skip forward just so you can see them working with different kiddos. And as you can see, for each kid, they choose a different reinforcer. It's what the kid likes the most. So I think the first one might have been like yogurt or something. For this kiddo, it's juice. Or some of the kiddos I've seen, it's like M&Ms. And there's one little girl, I don't remember if she's on this video or not, who like her reinforcement was hugs. Like that's what she liked. So admittedly, like I don't know if that would fly in this day and age the same way, right?
Mama. Mama.
Okay. Look at me. E.
E.
Contrasting sounds is important.
E.
E.
Good. Me.
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 Good. Look at me. Me.
Me.
Good. Mama.
Mama.
Good. Good. Me.
Me.
Look at me. Ma.
Ma.
I mean, in this case, the kid just wants to look at the camera. I'm like, hey, I don't blame you, kiddo, right? So here's another kiddo.
Oh, good. Hands quiet. Good. Sitting. Good. Look at me. Good. Say, ooh. Good girl. Very good. That's right. Shh. Put your hands down. That's good. Good looking. Very good. Shh. Good. Say daddy.
Daddy.
Good girl. Good.
So this girl, where they have a mix, sometimes she gets juice, sometimes she gets an M&M. Just again, to see them working with the
Being suppressed.
Say mouth. Mouth. Good girl. That's nice talking. That's good.
Good sitting. Sonia, look. Do this. Good girl. Do this. Very good.
They weren't saying Buddhist, they were saying to this. Again, caption's not always perfect, right? But again, so it makes some people uncomfortable. Some people don't like that it's essentially training away the neurodiverse behaviors that some people recognize as, again, the hallmark of their experience. Yeah.
For some children, it doesn't create an adverse relationship with food or that reward stimulus. Like, just kids who like hugs feel like they don't deserve hugs if they're having a bad day.
Yeah, I mean, that is always the problem when you're using reinforcement, right? So this would be, for those of you who have taken like areas of personality or clinical psych, this is conditional positive regard, right? You're only being reinforced for the behaviors they want you to do. And if you're Rogerian, you want unconditional positive regard, where you're going to support people no matter what. Which is another reason people like struggle with it. Yeah, I mean, honestly, as an eating disorder researcher, that does sort of make me uncomfortable because it creates that. Basically, what we try to do is teach people food is fuel, right? And we should look at it that way. So if you're using it as a reinforcer, it can create strange relationships. Yeah, I think that's a really good point.
That's not to say that I think the kids that benefit from it or that enjoy it or that are glad they have relented are in any way, shape, or form wrong. I think a lot of people take, pride or at least are glad they have the opportunity to practice neurodiverse or neurotypical rather. To match. That's something that a lot of autistic people appreciate having the ability to do. However, I think implying that like self-stimulating behaviors aren't really bad is probably.
I agree. Yeah, and that's why I think that there should be choices not only for the parents but for the kids themselves when they get to the point that they can be engaged in that conversation as well. Just like if you had, again, someone with depression or anxiety, it should be their choice whether they choose to like take medication, do therapy, what have you. Alrighty, that is all the content I am covering for this semester. So Tuesday on Zoom, next Thursday, our first time that your fellow students are getting you content for the final. Alrighty. Have a great weekend if I don't see you tomorrow.
Something it reminds me of is